Osteomalacia. It is disorder of the adulthood due to deficiency of the vitamin D in the human body. The production of the bone matrix is decreased and bones become fragile, tender, and more susceptible to the frequent fractures. Now the symptoms of the osteomalacia. As the bones they become weak, fragile, they can't afford the external stress and the traumatic injuries, so they suffer bending of the bones and the multiple fracture of the bones that leads to the disability of the person, which need the surgical treatment afterwards. Initially there is severe pain, bone pain, muscle pains, joint pains, there is swelling at the joints, fever, malaise, temporarily disability, there is decrease in the length of the body due to bending of the large bones. Mostly there is flattening of the hips, ribs, spines, compression of the spines that leads to the lordosis and scoliosis. These are the deformities produced by the compression of the vertebral disc and the spines. Most frequently, the large bones of the lower limbs they suffer as they are the weight-bearing bones. They become weak. Diagnosis of the osteomalacia. It is evident from the history of the patient and the physical examination, that is the disability and the typical waddling gait of the patient due to weakness of the and bending of the locomotive motor system, that is the various bones. X-ray chest, X-ray lumbosacral X-ray that also reveals the deformity in the spines, and the X-rays of the large bones of the lower limbs, CT scan, bone biopsy, and next is the lab test, that the analysis of the blood for the detecting the level of the calcium, phosphate, vitamin D, and these are decreased in osteomalacia, while the parathyroid hormone is increased and the alkaline phosphate level is also increased. Because alkaline phosphate produces the mineralization of the bones and excretion of the phosphate through the kidney. In addition to other diseases of the liver and the chronic disease of the kidney also play a part in the production of the osteomalacia. So when we consider the treatment, in addition to the symptomatic treatment, that is analgesics for the relief of the pain and the antipyretics for reducing the temperature of the body, we also put attention and treatment of the liver diseases and the kidney diseases, which are responsible for the production of this hazardous ailment and the disorder. Whereas when there is debility or bending of the bones, then we consider the surgical intervention and for the improvement of the patient so that he may be able to perform his normal duty and activity to some extent.